Welcome back. This is the video that you'll watch after you have added the calcium treatment kit to your pool. We want you to follow the directions that we give you because sometimes well-meaning pool shops will give you conflicting advice based on the water chemistry results that they see after you've added our kit. We've been doing this for a very long time and we know the best way to bring the water back to balance. We love your pool shop. We know they do a good thing for you, but in this case we just want to get the water back to where it needs to be first so that you can get the best result from doing that. So as we get started now, we want you to maintain the pH at 7.2. That is one of the most important things to do after the calcium kit has gone into the pool. If the pH is not maintained, what can happen is it will rise and it helps stop our treatment from working properly, and that's not good. We want that to work as best it can. So use hydrochloric acid to keep the pH at 7.2. Then we want you to keep an eye on the calcium hardness. As we mentioned in the first video, if it is higher than 600 parts per million, we have a page on our website under the news and blog tab that will talk all about calcium hardness and how to reduce that. So just keep an eye on that through the process to make sure that that is at the right level. Now, if you have a fiberglass pool, you can completely disregard this advice. Use the calcium hardness level that the fiberglass pool manufacturer recommends. Don't listen to your pool shop. Don't listen to me. Use the level that they recommend. They're often different depending on the manufacturer, so use the level that they suggest. When we get now to total alkalinity, you can use alkalinity increaser, buffer, sodium bicarbonate. It's all the same thing. That works to increase the alkalinity. We want you just to put 1 cup per day or every second day into the pool. Just raise that level slowly. You don't need to do that dramatically. If you do, it can cause issues. So although your pool test may say you need 3 or 4 kilos of alkalinity increaser, just do a cup every 1 or 2 days and add it slowly so you'll get the best result from that. Then once we do that, you'll then notice that the chlorine level in your pool will be low. Often pool shops will say your chlorine is reading at 0, or you have high combined chlorine, so you need to shock chlorinate your pool. Please don't do that. That is not a good thing to do for at least 8 weeks after the treatment has gone into the pool. There's a whole range of reasons as to why that I won't bore you with, but please don't do that. You do not need to shock chlorinate your pool. Your chlorine levels will read at 0 for about probably 4 to 6 weeks. That is normal. It doesn't mean that your pool has no chlorine. Our products stop the chlorine test from seeing the chlorine that is actually in the pool water. So don't panic. If you do the things that we tell you to do in this video, you'll be okay, even though the chlorine level is reading very low. So don't assume that your chlorinator is broken if your chlorine continues to read low. It is not broken, it is just not showing up in a test. You will need to use extra chlorine throughout this process. We talk about it in the instruction sheet. In most pools, it's about 1 litre a day, just for the first week or so, until the water gets back to its normal levels again. It may take a little longer than that, but the extra chlorine will help keep the water clear for that first little bit, and then your saltwater chlorinator or your normal chlorination system can take over from there. So you won't need to do anything after that. So now, once you get to that point, we want you to use this product here if you need to, which is a phosphate remover. It doesn't have to be this specific one. Use any phosphate remover from your pool shop. But basically what this will do is remove the phosphates from the pool water. Our products do have a small amount of phosphate in it, but also there can be phosphates that are bound to the pool surface, which our product has now released and put back into the pool. So very often some people find that their phosphate levels are actually quite high after our treatment, and this is the reason why. It's a little bit from our product and it's a little bit from your own pool that have now been dissolved back into the water again. This is the most common reason why pools will go cloudy after our treatment is high phosphates. So about a week or 2 after the treatment, probably around the 2-week mark, have your water tested for phosphates if the water is cloudy, as this will be the main reason why. Then after about 3 weeks, when you've had the treatment in the pool and you've been maintaining the water, if you still see any calcium lumps on the sides or bottom of the pool, we recommend either of these 2 products, whichever you choose, to give the pool calcium a little bit of a rub if it's still there. You'll find it'll be significantly softer and a lot easier to remove than what it was before you put the treatment in the pool. Some people prefer the pumice stone, but if it's a bit cold and you don't want to get in the pool, you can join that erased stick to the end of your pool pole and rub it that way without getting into the pool. They often wear out a little quickly, so be patient with that, but they generally work really well, and it saves you from getting into the pool. Then finally we'll start having you brush the pool just every few weeks like you normally should anyway. Brushing the pool helps to maintain the surface and to stop new calcium formation. So doing that regularly and using a good quality pool cleaner that gives the pool a bit of a brush as it goes around really helps. Now, when you're dealing with the calcium lumps, as we talked about earlier, make sure that you rub just the calcium, not the entire surface of the pool. So just rub on top of the calcium spots if you're doing that to make sure that you get the best result. And finally, we recommend, after you've now done all of this, to use our prevention treatment every 6 months to keep calcium away. Some pools don't ever need our products again. It's a one-time thing and they're done. But others have a real problem with calcium and constantly recurring calcium because of various reasons, some of which may have nothing to do with your water chemistry or your pool shop. And in those situations, we recommend as soon as you see the calcium starting to come back, use that product, put it in the pool just like you did the first time to make sure that it doesn't come back. And this works to prevent the calcium from coming back and works hard to maintain the surface as well. I hope this helps, and very good luck.